Well, David, hospitalization rates and daily case counts, just two of the metrics used by public health officials and the province to track and respond to COVID-19 and determine what restrictions are needed. But those numbers causing even more concern in this fourth wave, or as some have called it, the wave of the unvaccinated, just days before the start of the school year. A tweet by the Ontario Hospital Association states that there were 11 more adults admitted to the ICU with COVID-related illness on Saturday, for a total of 177. By Sunday morning, that number jumped to 179. The CEO of the OHA calling for eligible Ontarians to get vaccinated, tweeting, "Ontario is now experiencing consistent daily double-digit admissions to ICU of patients with COVID-related critical illness."
What the numbers are showing is that we're getting to a very critical point in who can we treat and who can't we treat. So it means that hospitals will have to maybe start delaying elective surgeries.
For a third straight day, the province recorded over 800 daily cases. Experts saying the Delta variant is driving the fourth wave, with Professor Thomas Tinkaid adding one person can infect 6 to 8 people.
We're going to be seeing these sorts of numbers for quite a period of time, because without implementing more restrictions, the conditions are allowing for transmission of the Delta variant.
In step 3 of Ontario's reopening, restrictions loosened, more people are out and about, and in just days, roughly 2 million students will be back to school, the majority in physical classrooms.
It is time for caution at the moment because of what we've seen is the cases rising, day by day.
Should we be scaling back restrictions?
We really have to think about bringing back some of the restrictions that we had, because what we've found is that restrictions that we have currently aren't stopping the spread.
Ontario's Chief Medical Officer of Health says going forward, he doesn't envision schools closing into the fall, winter and spring. Dr. Kieran Moore adds they will do everything to keep students in classrooms using public health measures.
I think the measures are very comprehensive, but we'll have to wait and see whether or not those are going to be, efficient or effective in the short term. And unfortunately, as a parent myself, I'm sort of bracing myself for the potential for kids to be, learning from home again.
Tinkaid is encouraging people to implement measures from previous phases and keep masks on even outdoors in situations where it's crowded.
Taking account of the previous measures that people got used to longer term, my sense is that some of those restrictions are most likely to come back in.
Now, the Ontario Hospital Association was not available for an interview today. And just a note for you, the province will not be releasing the daily COVID-19 data summaries on holiday Monday. Instead, that will be made available the following day, Tuesday at 10:30 a.m.